Hi, this is Stu and welcome to our little injury series, and today we're talking about the biggie. We're talking about knees. And I don't know how many practitioners there are out there that haven't experienced any issues to do with their knees at all. I mean, I'm really careful about my knees, but even so, there are some days when one knee or the other is a little bit iffy and we need to back off and take care of them. So why is this happening and what can we do about it? Okay, so the knee is, we call it a hinge joint, but which means it can do this and this, flexion, extension. But actually, when the leg is straight, there is no rotational element at the knee available. If you want to try it out on your own leg, you can just put your leg straight, whether you contract the muscles or not. You'll find that the lower leg relative to the upper leg won't move. If I'm moving this like this, it's moving actually at the hip. It's not at the knee. When I bend the knee, it actually will rotate. The lower leg can be rotated relative to the upper leg, and that is done so that we can adapt to uneven environments, What we do wrong, I think, in the yoga is that sometimes we accentuate those rotational movements, which puts too much strain in the knee, The other thing that we do, which isn't part of the knee movement, the lower leg isn't meant to move sideways relative to the upper leg, So it's not meant to move that way on that way, We would have great difficulty in stabilizing and walking if all those movements were available to us. Because of the design of the knee, which is basically two ends coming together like this, there's no bony protuberances that stop movement in any particular direction. So it's only ligaments that hold the knee and restrict it from going in particular directions, plus some muscle tendons, and the tone in the muscles. So it's a vulnerable knee, it's a vulnerable joint, and it's also between the two longest bones in the body. So it's in that area where stresses will accumulate in our chain from our hip to our foot or foot to a hip, whichever way the forces are going. And for me, they tend to bounce backwards and forwards. And this is the area where things get localized. So let's talk about some of the things that go wrong. The first thing, of course, is where we're going to feel the pain. And it can be that we feel the pain just below the kneecap, so sort of here. Well, again, if you want to just be sitting there while I'm talking to you with your leg out and just contract your quadriceps, which is this muscle, these muscles on the thigh at the front, you'll find it pushes your finger out, So this is the patella tendon, so the quadricep muscles attached through, crossing over the kneecap and then down onto the tibia and merging in with the fascia that's surrounding the tibia, if we want to be a little bit more correct. So we can land up with some pain here. Well, that's not normally for me to do with rotational elements. It's normally to do with flexion of the knee and maybe using some extra force in the quadriceps when the knee is flexed. So I see this area being aggravated when we're doing postures like, say Laghu Vrajasana, which is when we're kneeling in this sort of position. And then we're going to be going back, and we're coming back like this, and we're taking our heels, and we're going all the way down to the floor, And then we're needing to use our thighs to bring ourselves back up, So when we find that we're using them a lot, we want to use them strongly, but say we've got too much work going on, we're a little bit too flat, there's not enough, it's not going to be a posture where there's much curve going on, but we can be placing a little bit too much strain on the tendon via the quadriceps that are working. I know in myself I aggravated this sort of area when I was trying to get leg strength up for doing Kapotasana. And so what I was doing was to go down, lowering my head to the floor from here, going over the top, lowering myself down and really trying to keep strength in the legs and then touching the floor and coming back up again. And it was very nice. It was a strengthening exercise for sure, but due to restricted range of motion in certain areas, I think I was placing too much strain in the quadriceps and across to the quadricep tendons. So just watch those. It's good to work on the strength, but it is possible to cause some aggravation, yeah. If we're getting some pain sort of below the kneecap, yeah, this can be sort of patellar tracking or something to do with some imbalances around the thigh muscles themselves. And to be honest, if we weren't talking about yoga, then we would say that probably 80% of the pain we get around the knee could be due to some sort of tensional pattern in the thigh muscles, yeah? I mean, there's not just the quadriceps. Of course, we've got the IT band, the tension fascia lata, the sartorius that's coming through here, and the adductors down the middle. So some sort of tensional pattern that's not actually working to the best of our advantage, creating a little bit of imbalance and more forces going towards one side or the other, or stopping the patellar tracking particularly nicely, yeah? Of course, you're not really going to be able to work out what's going on with all of this unless you experience restrictions in certain movements. So I always say to people, you know, if you're super open in the hips, in your seated positions, in your Baddha Konasanas, in your Padmasanas, but when it comes to then rotate the hip the other way and do Triangle Mukha Kapada, that sort of thing, that you notice there's a massive difference, well, that is going to come out somewhere in the wash relative down the line, yeah? So you want to be trying to create that balance. Look for balance, see those areas which are not the same and work on those. Don't just leave it because they will just sort of stay the same. As you get more flexible, the differences will still be there, yeah? So the next big thing that we see is pain either on the inside of the knee or on the outside of the knee. Now, we have two important sets of ligaments around the knee which are working on that stabilization. We have two inside, so this is the cruciate ligaments, the anterior and posterior cruciate ligaments inside the knee. Very common injury when it comes to football, skiing, those sorts of things, but really not common when it comes to yoga because we don't have those same sort of forces. There's sort of, what tends to happen is it's a medial movement of the knee along with some flexion and a combination of movements that creates that dramatic strain. Yeah, so we don't have those sorts of strong forces in the yoga that we do in those either contact sports or where you have contacted something like in skiing and you continue on but your lower leg doesn't, yeah? So it's not normally the cruciate ligaments that we have problems with. It's either the meniscus, yeah? So that's like a cushioning area between the upper bones and the lower bone of the leg. And it can be squashed and then it can either fray or tear because of particular forces at play. So it's either that or the ligaments on the inside or the outside of the knee, which are called the collateral ligaments. So this would be the medial collateral because it's on the inside, or the lateral collateral, yeah? We can get a little sense of what it is by having a little feel here. So if we have medial knee pain and we can find the ridge which runs like this between the tibia and the femur, and the pain is localized in that ridge area, then it indicates a more likelihood. You can see how reticent I am of saying it's going to be this because it's a very complicated area. It's just going to give you maybe a direction of thought, yeah, that it might be meniscus, yeah, if it's in that line coming across this way. If it's in this line coming across this way, and we can feel maybe starting here that there's some discomfort all the way along in this line, then it's more likely to be the medial collateral ligament, yeah? So how do we hurt these particular areas in the practice? Let's start with the medial meniscus area, yeah? Mostly it's when the foot is in Padmasana, yeah? So, and that we're not open enough in the hips because of this movement that I said isn't meant to be available at the knee, this talking movement, yeah? So when we're coming to put our foot into Padmasana and we want, maybe I'll do it the other way around, I'll do it with this leg. We want lots of external rotation available at this hip so that then we can just taking here, we can slide that foot in and the knee should be near enough relative on the floor and the foot in the hip crease, yeah? If the knee is up here, we can see that we are not open enough in the hip, and we're placing strain here because this part, and it's normally actually the second leg in that causes the problem. So what I'll do is I'll reallocate myself. I'll put this foot in first, and then I'll just give you the demo on this side. We've got this foot in, okay, and now we're going to get this foot in. If I now just pick up that foot, yeah, I have to pick it up over the top of this leg to place it into here, yeah. This foot is holding this leg down basically, and there's not a lot more rotation happening there. So unless I'm already quite open, then what can happen is if this leg is stuck on the floor and I'm trying to pull this leg up without much regard, I'm basically torquing the knee and playing pressure in here, yeah. This isn't a video about getting into Padmasana, but there's better ways of doing it, basically crossing more towards the center. But this is what I see as one of the major problems as far as Padmasana goes, is the lifting of this second leg in. And it just so happens that the majority of knee issues relative to meniscus seem to be more left knees than right knees in the yoga community. And I think it's because it's always the second leg in Padmasana, yeah, particularly if you're an Ashtangi. So one of the things to do, first of all, is to keep changing around your crosses, yeah. Not only will it create more balance, but it actually creates less stresses continually on the same leg, same joints, okay. So you've also always got to be careful of getting those legs in. Now, it's one thing to be doing it on the floor. I really don't think it's clever to be lifting up here and doing the same sort of thing. I think, again, you have the tendency to torque the knee. And then you have to be actually even more careful when you're doing in the finishing sequence, when we're in our shoulder stand and then we're bringing our legs into Padmasana there, because again we're trying to stabilize and move at the same time, and it seems that much more easy to actually torque on the knee. So really be very careful and go in slowly with those sorts of things. I heard a lot of people that have had knee issues that are experienced practitioners, actually really quite open, but it's almost they are become too relaxed, and one day they're just not paying attention enough and they're not really warm enough, and they come in and then they just bring their leg up, and then all of a sudden they hurt. When really they are open enough to do the posture, it's just that particular day they weren't, but they weren't actually listening to what was going on in their body. They were just going through their thing that they always do, okay? So just be really careful about your Padmasanas. Just remember that this is the weak area relative to this chain from foot to hip. And just spend some time opening the hips, and all this will become easy. So don't suffer with pain in the knee, yeah? If you're in a posture and you're feeling it in your knee, there's nothing you need to open in your knee, yeah? You need to open your hips, yeah? So no amount of suffering pain in the knee will actually get you further in your practice. It will actually probably just stop you dead in your tracks at some stage, and you have to spend some time recuperating either from a meniscus surgery or just from whatever other pain you've caused yourself. So really be kind to yourself, look at what you're doing, don't force it, and just be careful with the knee, okay? So we were thinking predominantly there about meniscus-y type injuries, medial knee pain. I don't know what the figures are, but I know that some things you read, they say 85-90% of people will be feeling pain on the inside. The other 10-15% feel it on the outside in some of these postures, yeah? If you're feeling it on the outside, the same sort of thing goes. You're torquing it some way, so just look at what you're doing and open your hips in the relative direction that they need, and be comfy, yeah? A sort of temporary fix sometimes is to put like a sock or rolled up bit of cloth in this space here when you close your leg, and that just gives you a little bit more room if you are squashing. But for me, okay, if you've got a dodgy knee because you've already done something, that might be a temporary solution, but the end of the day, for me, it's still pointing to the fact that the hips aren't open enough. So open the hips, and this area will sort itself out. Yeah? Another big area where people feel discomfort in the knee is when we bring our foot back this way, yeah, and we're bringing it back into Triangle Mukha Pada Paschimottanasana with this leg folded down the back, yeah. The hip does need to allow some medial rotation for this to occur, and some people again will feel discomfort on the medial aspect of the knee. And for me, this is to do with how much the lower leg has been torqued relative to the upper leg again, but this time we're moving it, if you think, we're moving it to the side relative to the upper leg, yeah? And we want to minimize that. Now, why do we do it? Why do we does it get moved to the side? Well, we're not going to be sitting on our heels, so there is a certain amount that needs to happen. But if we've got big calf muscles, okay, then the tendency is that we feel we need to get them out of the way because we can feel that sort of squashing feeling, yeah? But the problem is that the bigger they are, the more you feel that you need to do that, but probably the less likely it will do you any favors when it comes to the knee, because the more muscle that we have here, my calves are relatively big. If I roll them out for you, yeah, the more flesh I have here, the more it's going to be pushing my lower leg out relative to my upper leg, yeah? So more likely I'm going to actually be torquing here. So it's one of those sort of situations where the more you feel you need to do it, the probably less likely it will actually do you any favors. If you can, rather than just roll out the flesh, take it back, that is actually much nicer for you. So you have to create some space, put your thumb in and draw the flesh back down your leg, and then see if you can keep this ankle as close to your knee as possible, or as close to your hip as possible. Don't let it wing out too much, okay? Still on this sort of thing, something that is maybe let's go to here and I can show you from here. If we take hold of my foot, this now becomes a lever, yeah? And I can use my foot to rotate my lower leg relative to my upper leg, yeah? And we have to bear this in mind, that that might not be our intention, but that can be what happens, yeah? So if I happen to be sitting in, say, Virasana or some sort of seated position, I'm going to just do it on one side because I don't sort of like it. And I have my foot pointing out to the side, yeah? You see how I'm trying not to put my weight on myself just so as I can demonstrate this for you. But for some people, it is actually possible to sit up straight, but with having their foot out to the side. Well, you can probably see what it's doing to my knee, but what's happening there is my lower leg, my foot and my lower leg is rotating my lower leg relative to my upper leg. So again, it's that torquing action. So I really would advise about sitting in any sort of position where the foot is pointing out at 90 degrees to the body. Tuck it in, fold it back. Yeah, it's much, much safer for the knee. Yeah. The same sort of thing can happen in our Janu Shirsasanas, okay? Here, I've just changed my hip around, but now my foot is here. It's that same sort of thing. And now what can happen is, if I'm not open enough in the hip, again, here I need to start thinking about folding forward. So what's happened here is to actually lay my leg down, I've externally rotated my hip. Now my leg is going to stay where it is, and I'm going to move my hip relative to my leg. So first of all, I move my leg relative to my hip. Now I'm going to move my hip relative to my leg. So we've got external rotation here, and now we've got more external rotation as I come forward. If I've used up my amount of external rotation that I've got in my hip, and now I start to come forward, and I'm going to try and sort of demonstrate this for you, can you see how this leg is coming with my hip, yeah? So now it's coming with my hip, but I have my brake, yeah? I have my foot stopping my lower leg from rotating with my upper leg. So again, I can have that rotation of the upper leg relative to my lower leg. So if in the Janus and you're coming forwards, you're feeling pain in the medial knee, this is what's happening. You're not open enough yet in the hip. So ease back a little bit again and look after it. one thing I found that sort of suits it, and it does a sort of a double job at the same time, is by actually taking this heel out more, okay, we become less symmetrical in the hips, but we have a nice straight line here, which means that I can actually roll a little bit on this leg. It's actually more opening in the groin than the other one. And from there you can then come forward here. So if you find discomfort with the first one, try this, yeah? But I think if you're going to do this, to try and get your body right over this leg is going to be a bit of a game. So instead of coming across this one, just come straight forward instead, yeah? And see how that feels. That might sort of sort it out for your knee, or at least be kinder while you're recuperating. And for some people it might be exactly what they need to get a little bit more space here too. So have a sort of play with that, yeah? The same thing goes, we'll carry on with this vein for just another minute or so, but just about this same foot issue, yeah? The same with when we're doing pigeon. I'll do it with this leg forwards, yeah? There's a lot of talk about what I should be doing with this foot, yeah? Well, in this position, if I was to lay down now, again I'm holding myself up so as I can talk to you, but if I was to lay down, it should be relatively fine because of the fact that I'm at 90 degrees, this part isn't moving, and my torso is sort of coming down. But if I had my foot here, and now I come down, can you see how this leg wants to rotate again relative to this fixed lower leg? So if you're taking your leg back because of tightness in the hip, which of course you may well have to do, yeah, then if it gets back here, then point the foot, yeah, because again that is going to allow this all to move at one and take the possibility out of torquing of the knee, yeah. And then the same thing goes for if you're a fan of frog posture, which I sort of actually quite like, where your legs are out quite wide and then you're dropping your chest down. If you're quite narrow, if you're quite a narrow stance, can you see that by having my foot pointing out like that, that again we have this same lever rotating my lower leg relative to my upper leg, yeah? So this is if I'm quite high, that will happen. So if you're quite high up because you're tight in the groin, again, point your feet backwards, yeah, because you'll find that it's much nicer on the knees, yeah. Of course, anyway, have something under your knees, maybe a double-folded mat, because they are, you know, they're delicate rather than being on the concrete. I'm only doing it because I'm just demonstrating it quickly for you. If you're very low, and I'll try and demonstrate very low without doing myself a mischief, then by all means you can turn your feet out, because can you see that the angle difference, the angle is different for my knee relative to my lower leg. So there's not so much of a problem, yeah? So a good indicator of where your feet should be is if your inner heel is lifting up. If your inner heel is lifting up, then basically point your feet. If you're in a position, so if I was here and I was trying to do this and that was lifting up, then I need to point my feet. But if I can get way down here, then I'm okay to actually point my feet outwards, yeah? So just think of the actions that are going on in your body and how you're using different parts. I know we've looked at Janu C in a separate video, and we talked a little bit about, I was taught to go into it like this, yeah? And you can see it's exactly the same thing. In fact, you can see it happening. You know, I'm actually rotating my lower leg relative to my upper leg to try and get it round and in there. I won't go into that now. If you're interested, watch that video and see what I have to say about Janusi and how it was actually nicer to go into it a slightly different way. But it's always about what is happening with this lower leg relative to the upper leg, yeah? I'm just going to show you one more, which is to do with the warriors, and this is going to be Warrior 2. It can be also repeated in Prasarita Padanasana, any of the Prasarita Padanasanas where we've got our legs out, so the same sort of thing goes. And what we'll do is we'll just cut in a little bit of a video here and I'll talk us through it while I'm in it, and then I'll come back again in a sec. So here we are in our Warrior 2, okay? And what I want to talk to you now about is, okay, the leading knee, that we often take our attention to that, and we want the knee tracking in line with the foot, of course. That's a biggie, and we want to make sure that we're lifting up on the arch of the foot, and we want to be engaged in the quadriceps to work on our strength. That's cool. But the back leg, okay, if we let that back foot lift slightly, can you see that the weight is being potentially dumped down onto the inside of this knee, where my weight and gravity is coming down, but I haven't got enough connection to be working on the inside of the thigh, okay? So what we need to be doing, and this is going to be stressing that medial collateral ligament, yeah, on the inside of the knee. So what we need to be making sure that we're actually doing is to be pressing our outside edge of our foot down into the mat. And can you see how that lifts up on the inside of the thigh? And the other thing we want to be doing is engaging here and drawing up. So being very active, even though we're sinking here, we're drawing up there. So we're creating this buoyancy, this balance, and that is going to protect this inside of the knee. The same thing goes if it was a Prasarita Padottanasana posture, again, and I'm letting my feet come up slightly, I'm going to be dumping it onto the insides of the knees. So pressing the outsides of the feet down, drawing up on the inner thighs as I'm then folding forwards, yeah? So they're the big ones that tend to stress the insides of the knees. Of course, any one where you're actually taking the knee into strong flexion, and there is some openers that involve us flexing our knee and taking our foot towards, maybe we'll show that to you in another video when we're looking at the quads. But any time when you're strongly flexing the knee and the lower leg isn't quite lined up, there's potential for stressing the kneecap. So always work gently around the knee. And just remember that you don't need to suffer knee pain to actually get more open in the yoga, yeah? You really just need to bear in mind that it's vulnerable. It will stop you in your tracks unless you listen to it, and work at the hips, yeah? So all these Padmasanas, it's about the external rotation in the hip, yeah? Balanced then with working on a bit of medial rotation to even things out, yeah? But basically look after your knees, yeah? And I'll see you next time.